name is Richard Davis. I'm here in the purple shirt and the headphones. And joined with me today is Dr. Adam Ramsey. Dr. Adam Ramsey, we're so grateful to have you here with us today, and honored too, by the way. And why don't you just take a second and tell us a little bit about yourself, and we'll get things kicked off.
Well, thank you, Richard, and the whole Weave team. My name is Dr. Adam Ramsey. I own Socialite Vision in Palm Beach Gardens, Florida. It is a boutique optical. We do everything: glasses, contacts, dry eye, diabetes, the whole 9 yards. But we try to have a little fashion and flair with it. I do a lot of speaking and educating my peers and colleagues on different topics, just like this. I kind of love to engage and mix up the day and mix up the week. So I'm excited to be here and excited to bring some of my knowledge about the Weave platform to other providers, office managers, et cetera, that would be listening today.
Well, thank you for that. And thank you for what you do, especially in the medical community. Really honored and appreciate you taking time to be with us today. For those who may have not known, Dr. Ramsey was going to join us here live here in the greater Salt Lake City area. He's going to fly here from Florida, but his flight got canceled. And so now we're doing this remote, virtually. So just again, thanks for taking the time. So I'm the head of payments here, and I'm going to kind of be leading our discussion today and leaning on Dr. Ramsey's expertise in the use of the Weave platform and of our payment solution. This is one of our most anticipated webinars, Dr. Ramsey, and I think most of it's because of you. But I'll say that I think the subject that we'll be talking about today also has a little bit to do with it. But let me just kick things off. No pressure.
You're supposed to say no pressure. You say no. You're supposed to follow it up with the no pressure. It's going to be good. Just like
I was getting there. I was going to get there, but you did it for me. No pressure.
There you go. I like that. It feels better.
No pressure here, but I think a lot of people care about what we're going to be talking about, which is how we achieve the right balance between outstanding patient care, which we know a lot of our medical professionals care a lot about, but at the same time, how we can optimize the overall collections experience for patients and our practices at the same time. As you know, Weave is a software solution that enables many small to medium businesses, especially in the medical practice, to create and manage more meaningful connections with their patients. And we know that medical professionals care a great deal about the relationship they have with their patients. And in fact, I've met many doctors myself who oftentimes don't even bother with attempting to collect balances and, among other things, related to the practice, because they would rather maintain a close relationship with their patients and just don't want anything to interfere with that. But we still want to make sure that our medical professionals get paid. They work hard. And running a practice is still a business, right? And the reason Weave even got into the payment space in the first place is because we recognize that effective communication has a lot to do with improving your ability to collect efficiently from your patients. We see in studies and data today that one of the biggest gaps that practice administrators have in their workflow in attempting to bill and collect from patients is being able to effectively engage and communicate with patients once they've left the office, what balance they have remaining post their care. Okay. And so we know that patients are now consumers. They've become more in the consumer spotlight. They have more visibility into the experience they'll have when they go to a practice. And as a consumer, they have preferred methods and ways of they prefer to be communicated with regarding their bills and their payments, as well as preferences into options they have into making those payments against those balances. Let me just share one data point, and then we'll get into the questions with you, Dr. Ramsey, and look forward to having you educate us in this area some more. But I've seen a study that shows that as much as 65% of patients will change their providers in order to meet their billing preferences. And I can support that myself. I've been to a doctor, and post the visit, I get a statement in the mail. And the options I have to pay that statement are either to take time during my busy workday to call and make a payment over the phone, or I have to write a check out, which I don't even have a checkbook anymore, and put that in the mail. And that's just not an effective way for me as a consumer to make a payment to my medical provider. Okay. And so we're here to talk about finding the right balance between practices continuing to give patient care while also maintaining optimization with their efforts to collect from patients and just provide an overall great experience. So we'll break this into three major areas. We'll start with discovering how collections can impact a practice's patient experience. Then we'll talk a little bit about how to collect payments more efficiently and easily, and then how to maximize revenue within the practice in the midst of regulatory changes and policy. So, all right, Dr. Ramsey, let's kick it off with this question. We'll start in the area of discovering how collections can impact the patient experience. In your own experience, how have patient expectations regarding billing and payment options evolved in recent years, and how are medical practices generally adapting to meet what those expectations are?
Well, thank you for the question. I would say that people want to do business with people it's easy to do business with. And you have to make sure that your office is easy to do business with. We don't want, we're in an Amazon age. People like quick, fast, easy, one click. They don't want to have a lot of layers in between their provider, the office, and their ability to pay for the services that they're asking for the goods and products that they're trying to request from you. So at my office, my goal was try to make it, how can I make it as easy to do business with me as possible? How can I meet the patient where they are? How can I find a way that I don't have any stopgaps? I don't have anything that makes it a hassle to do business with me. So I try to find a way to put on, I have the link on my website where they can pay a bill. I use text to pay where we text them a payment option. I give them, you can hit your phone here. We were using Sunbit. You can split it up. All the different things that Weave is offering through that platform. I try to make sure that I was taking advantage of it and offering my patients that ability to make those payments as easily as possible. Because sometimes people think they don't want to pay, but it's just that we're in a convenience age and people just want it to be convenient to do business with your business. With your business. And if it's difficult, there's a lot of layers in between. You say, you know what? I'm going to go over here instead of there. Because think of it like, there's a Starbucks that's on my way to work, right? But on my way to work, there's probably about 10 Starbucks, but only one of them has a drive-through. And that Starbucks is the busiest Starbucks all the way through. Now, the people that get from that Starbucks know it's going to be busy, but I do not have to get out of my car. And it takes me 30 minutes to get a coffee. But if I went 5 more minutes down the road, I can get out of my car and get a coffee in 5 minutes. But because I don't have to get out of my car and I get to still listen to my music and I get to do whatever I want to do, I stay in the car and they'll spend more, they'll do more, and they'll spend the time more to go to that store versus another one because it's just easier, convenient. I do not want to get out of the car. People don't want to get out of the car. So you have to say, I look at your business and say, how can I make it easy to do business with me? And if you do that, people want to spend more and they will spend more.
I love that comment. That's a great call out. Convenience definitely is an age that we live in as consumers. You'd think that the other Starbucks along the way would go, whoa, that Starbucks is really busy. They've got all my customers. Maybe we should install a drive-in too, but they don't. And I think that plays into how medical practices often are slow to adopt solutions that make the patient experience convenient, especially in terms of billing and payments, right? You mentioned online bill pay and text to pay. And in terms of convenience, those are two of the highest preferred methods of notification and payment that patients have today. And I don't know if practice administrators really realize that, but that's the driving concept that you're referring to is we don't want to talk to each other on the phone. We want to text, right? And I don't want to have to make a phone call during my lunch break. I want to go online and make a payment. I want that drive-through experience. Yet, why is it, do you think, that practices are still slow to adopt the drive-in experience, so to speak, or in other words, those conveniences you're talking about?
I think some practices are still stuck in 2010 and they feel like I want to give this Disney experience in which it's all this hand-holding and talking and communication.
Yeah.
And actually, the 2023 Disney experience is the least amount of talking possible. And sometimes people are still stuck in the way it was before, that people want to communicate and want to engage. And I want the customer to have to come in my store 6 times because that gives me an opportunity to sell them glasses. Well, actually, your opportunity to sell them the glasses is not necessarily the amount of times that they come into the store. It's how easy it is when I come into the store to do business with you. So sometimes people get stuck in the way it used to be, and it's not that way anymore. The store that is the easiest to do business with is the store that people want to continue doing business with. So at my office, I just try to make it as easy as possible. The difference is a text message, you almost have to respond because it comes up on your phone, right? An email can get lost. So you can email somebody a bill and they can get lost. A text message, a lot more. My click through is way higher on the texts that we send out versus the emails we send out. We still send them out, but the response rate is much better because you have to make a decision with that text message. It shows up at the top of the queue. You have to decide what you're going to do with that information.
Excellent. So let me ask you two follow-up more questions to that is how can medical practices find the right balance then between providing that convenience and then how has Weave Payment specifically helped your practice improve your overall patient satisfaction and collection efforts?
Well, the second I started offering variety of payment options, people were happier and more satisfied with the same thing I was offering, the same price points, the same everything. My collection rate went up about 25% in what people were willing to pay and what they were receiving from our office because it was easier to do business with us. Because we now offered a variety of ways in which you can make that payment with us. You know, we use the Sunbit platform to offer split payments through the Weave, that partnership that you guys have. And now all of a sudden, like, hey, 3 payments and Dr. Ramsey pays the interest. That's how I say it. I don't say it's interest free. I say Dr. Ramsey's willing to pay the interest for 3 months for you. You know, would you like to move forward with the transaction? And now all of a sudden, we're giving them the option to pay right now. They want to think about it. Okay, if you want to think about it, that's fine. We're going to send you a link. We're going to text you the link. And then all you have to do to agree to pay for it is pay the link online and we'll process the order. No other conversation is needed. If you pay for it, we'll then process it. And the patients are able to do that. And hey, sure, you want to split it up? We're going to offer you the ability to split those payments up over 3 months. And Dr. Ramsey, because my staff love to like stick it to me a little bit. So when they say Dr. Ramsey is going to pay for it, then it feels different because they have to understand somebody is paying. It's not interest free. Somebody's paying for it. So, but when they say Dr. Ramsey is going to pay for it, then all of a sudden they're like, oh yeah, let me do that one just to kind of stick it to them a little bit. And I'm like, okay, I'll take it, but pay me now though.
You mentioned, I love the call out here. You mentioned you offered a more variety of payment options. And I've got a statistic here I want to share with everybody that the average US consumer wants at least 3 different payment options when they're paying bills or checking out as a consumer. And you mentioned that you offer a variety of payment options. You know, you've got text to pay. You got the ability to take payments probably in your office. You've got an online payment link. Sounds like you're offering maybe some financing options or recurring billing, subscription payments, or buy now, pay later type options. But those are different types of options that even Weave offers in its payment stack. And to Dr. Ramsey's point here, the more variety you offer, the more likely you are to improve that patient experience and ability to collect for your office. So, Dr. Ramsey, with the rise of high deductible health plans, what steps can medical practices take to mitigate the impact of patient payment delays or non-payments?
I think even with the high deductible plans that we're all seeing, everybody's seeing it in their office. I think it's the transparency of what am I paying? Why am I paying it? If you can be clear and transparent and consistent, people understand the plans that they have been receiving. They understand what they selected. They understand it. You just need to be clear and transparent with your pricing, clear and consistent with how you're doing business with that consumer. So what I would do is I'll take a payment and then say the payment wants to be a partial payment. And then it says right after we do the partial payment in the office, we text them the link to pay. Right then, we're not so that whenever they decide to pay the rest of it, they can pay. They're not waiting on us because that's what I don't want the patient to be like. I was going to pay you, but I didn't know how to. I couldn't call, or it was the weekend, or it was the night. You can pay me at any time. You wake up out of your sleep and you want to pay me, you can pay me. So we take the payment and we send them the link right away for the balance. And we're then also emailing them the bill so they can actually see the transparency of this is what's paid, this is what your insurance paid, this is what is left. And then they can have that conversation with themselves right there, work it through, and then make the payments. I think once we are clear and transparent with our pricing and we're consistent, I think if we're consistent, we give the patient the ability to trust and have that validity with our office, that they understand that we used your insurance, we submitted it to your insurance, this is what they paid, and this is what is left over, and this is your portion. I think people want to pay. They don't want to dip out on their payments. They don't want to skip paying that office because they want to come back to your office. If you're a good office, they want to come back to your office. They want to see you. They want to continue that relationship. And they know to continue the relationship with my office, you have to pay the bill that you're assigned. So they want to pay it, and then they pay it.
Great. Excellent. There's three things I've heard so far that I want to just recap and make sure that are clear. So you first talked about convenience, making sure that we're delivering patient preferred methods that are convenient for them. You talked about having multiple and alternative payment options that the patient can make a payment through. And then transparency is also very important. Are there any other problems within your patient collection workflows where you feel like Weave Payments has helped solve? Workflow is a term we like to use here. And we know that within a medical practice, it takes quite a bit of work to find patients with balances and communicate what those are and then present opportunities for them to be paid. But do you feel like Weave Payments in general has helped solve some of the workflows within your own practice?
I would say definitely the payment solutions that I offer at my office. I try to relate my staff and get them to see, what do you get offered when you go out there? And I ask my staff, everybody bring their phone, and everybody brings their phone out. And I said, that's a iPhone 14, 13 Pro Max. I says, when you went to buy that iPhone, did they say it was $1,400 or did they say it was $58 a month? It was $58 a month. Right?
Yeah.
If you get the lower one, it was $35 a month, whatever. They didn't say the phone cost $1,400 because nobody would buy an iPhone for $1,400. I would buy it for $35 a month though, because the lady would say, would you like it to be faster, shoot better pictures at night? Would you like the battery to be longer? Yes. Okay, for $35 a month, you can get a brand new phone. You can leave out of here with it today. Sign me up. If she said it's $1,400, do you want it to be faster, lighter, and shoot better pictures? No, not for $1,400. I don't think it's worth $1,400, but it is worth $35 a month. The same thing I tell to my staff. I says, when you're selling a year's supply of contacts, when you're selling the 2 pairs of glasses, you don't sell it as $1,000. Sell it as $85 a month, 12 payments of $85 a month. That's how you sell it. You have to sell it differently. You say, would you like to get this? And we split it up, and this is going to be your cost today. And you can get both pairs. We edge in-house today, and we can actually have it for you later today, or you can get it first thing in the morning. It's going to be $85 a month. We're going to set you up on a payment plan. Would you like to move forward with it? For $85, yeah, I can do that. I can pull that off. And they get the product and they go because it's the way you phrase it. And I think when we're doing payments and we're doing things, we have to look at it as putting ourselves in the shoe of the consumer and the customer. And how you phrase and how you put something together really does matter. And if we can make it easy to do business with, if we can make it so that it's convenient, we can make it so that it's not a lot of steps in between. It's not a lot of paperwork. It's not a lot of questions being asked or a lot of stuff where I'm not having the patient think too much about all the different stuff. Then all of a sudden we can do business with them. And he's like, I like going over there. They give me stuff. And now all of a sudden I'm the affordable guy. When I'm in Palm Beach Gardens, nobody's going to say my office is affordable. There's nothing, that's not my office. But $85 a month sounds affordable. If they'll walk out of there and said that I charge $1,000, then all of a sudden, he's expensive. I don't like going to their office. And that's the phrasing and wording matters. And how somebody thinks about my office now is that Dr. Ramsey gave me a lot of options. I like that. I can pay for it right now. I can put half of it down and I can pay less in 2 weeks and I get the product. They gave me options, and the patient can choose for themselves what is the best way and what is the best thing for their budget. Because for some people, this is the way they like to do it, and for others, they say, no, I'll do it this way. And it's a much better transaction.
And you find that your patients respond well to that kind of a presentation, right? To what the options they have to buy contact lenses or. Right?
Yeah, it's giving them options. So I'm not forcing them to do it my way. I'm saying which way would you like to do business with our office, and how can I make it the easiest for you?
I love that.
If you put the choice in the patient's hand, we're not forcing you to do anything. We're not upselling you. We're not doing anything. He says, hey, well, they say I can afford $500 right now for the glasses. Okay. I can't afford $750 because you give me the second one half off, whatever. I can't afford $750. Okay, you're right. Okay, you can't afford $750. But what if I told you you could do $75 a month, and then you can get both of them. Because if you try to come later, I'm going to charge you the full $500 for the second pair. But if you do it today, and I only charge you $75 a month, you can get both of them. How would that sound? Well, for $75 a month, yeah, I would get both of them. Yeah, that's much better for me. So now I've changed the conversation, and now I'm the good guy instead of the bad guy, because now I'm the person offering them an option to get what they really want, which was I wanted two pairs. I could only afford one, because I don't think nobody comes in and says they don't want multiple. Everybody wants a sunglass, clear glasses, driving glasses, contacts, the dry eye drops, the dry eye procedure, the IPL, all the different stuff. They want all the stuff. The only time a patient ever says no to me is when it gets to the money. Nobody ever says no for anything in the office. They all want all of that. Yeah. The only time they push back on add-ons is when there's a cost. With VSP, sometimes there's no cost for transitions or no cost for a progressive. They never say no to the no cost. The only time they say no is when there's a cost associated with it. So now it's just a matter of how can I make their concentration go away from the cost, go away from the big ticket item, and get it down to a smaller number, a more manageable number that's not going to hurt. That's not going to move the needle, and it's not going to have to make them make decisions, because people are always thinking about birthdays and Christmas and anniversaries, and I got this trip coming up, and I got to put new tires on the car and all the other stuff. But if I now get it down to a number that's a lot more manageable, it doesn't make them have to make life or death decisions in my office when everybody's staring at them and they're trying to rush to make a decision on a product.
That's brilliant. I love that. You use the term sell. And there's a question that was coming up about how practices can maximize their revenue, specifically how they can more effectively communicate and collaborate with patients regarding billing related matters. But what I heard more than anything was that, and sometimes it requires sales effort, right? And practice administrators just have to know that part of their job is to do that. But what I heard more than anything is you take time to educate patients what their options are, give them the transparency like you were talking about earlier, the convenience of it, and educate them on what their options are. And this response rate is really good. So really, it's just a matter of taking time to educate them, which is what we like. I'm going on the record of saying that as a consumer and patient myself. I love that when a practice takes time to give me my options, what they are, educate me them, and set the expectation that there is a payment required at this point. I love it. So that's brilliant. I appreciate that time. Let's talk a little bit. Yeah, go ahead, please.
So in my office, and we're going deep here, but I'm gonna give y'all a few more free nuggets here. In my office, I tell my staff, I'm not asking you to sell anything. I'm asking you to meet a need. They have a need of a progressive, right? They have an issue of the light is bothering them in their eyes when they step outside, so they're photophobic. So Dr. Ramsey is prescribing these photochromic lenses for you, and the solution is this right here. You have the complaint of when you drive into the sun every morning when you're going to work, the light bothers. So he prescribed you these photochromic lenses, and he also prescribed you these sunglasses. So now all of a sudden, my staffer is not selling them anything. They're solving a need. And I like my staff to also remind the patient, you asked for that. You said that the other lenses dried out on you. So Dr. Ramsey then prescribed you these single-use lenses that are thinner, lighter, more comfortable. So now they won't dry out on you. So now I'm not selling them anything. I'm prescribing, and that allowed my capture ratio to go up about 30%, because now in that time when the staff is making that transaction with the consumer, they're like, you know what, I did say I wanted that. Because then the first thing they think about is the monthly contacts are cheaper, the daily ones are more expensive. But when we remind them, you said the other ones dried out on you, they bothered you at the end of the month. Now all of a sudden, yep, I said that. You're right. I said that, and that's why Dr. Ramsey did that, and that's why there's a cost here. But now when I'm reminding them, now all of a sudden my capture rate went up 30%. My effective sales went up about $200 when I switched the way I talked about the conversation, the way I mentioned it to the consumer. Now my average ticket went up because I'm doing more business with that patient, because I reminded them on what they had an issue and why they came to me and why we made that change. Because sometimes patients forget from the time they leave the exam room to the time they sit down with the staff, somehow they get amnesia with why did we do this? No. He only changed it because you asked for that. And then if you remind the consumer, hey, you asked him for this. You said the sun was in your eyes and the transitions didn't work in the car. So now we need something. So he prescribed the sunglasses for you so that he can help you. You asked for that. Yeah, I did. You're right. And then when you remind them that all of a sudden now your ticket price goes up. All of a sudden now the conversion rate is much easier. All of a sudden now your capture ratio is higher because you and the patient are agreeing on, I asked for that. He's giving me this option. You're right. I do want it. Here you go. Here's my card. You're right. I did ask for that. And then they don't try to take stuff off as line items.
I love it. That's the balance right there, folks, is he nailed it right there, is that patients have a need. They come to you because they trust you as a medical advisor, as a caregiver, and provider. And it shouldn't be a problem or a concern for you to have real conversations about how to solve their needs and present to them in a transparent and convenient way options they have to solve for those needs. They trust you, and that's why they've come to you. And so that's the balance right there that we're looking for. So that was great, Dr. Ramsey. Do you find any emerging regulatory or policy changes that may have relation to affecting patient billing or collections, or how can practices, I guess, stay compliant with regulatory and policy updates while maximizing revenue? And then I'll let you just add some additional commentary and we'll close out from there.
All of the current legislation that's coming through optometry and come to any business is talking about clear transparency to make sure the customer knows ahead of time what they're supposed to be paying. And then when they're done, they get everything that they paid for. At the end of the day, that's all it is. And at my office, we were doing that before. So we email them in advance through the Weave platform what their expected copays are. They know this transparent. Hey, this is what you're going to pay in advance. They said they want to contact. They said this. It gets an estimate. It may not be exact. We may change it because they don't know what's going to happen when they come in. We give them that part. And at the end of the transaction, we send them through email again their receipts and their prescriptions. And once you have that clear transparency, that's the only thing that people and any kind of legislative body was actually trying to make a difference in optometry and in any profession is, hey, you're supposed to do this. You should not put a gap in between you and the patient. They paid for this service, give them their prescription. If they want to go somewhere else, that's on them. At the end of the day, they paid for that good and service. You have to do that. So, through the Weave platform, we send them everything. We text and email, and we allow them to be in contact with us easily. And we want to be easy to do business with. And that's what we offer.
Love it. Dr. Ramsey, I could go on and on with you for a long time. I've benefited from this personally so much. I think our team's going to have a lot of takeaways on ways we can improve our customer experience interactions to help them kind of follow the same process you guys have within your practice and find that balance between patient relationships and also at the same time making sure you're making money within your business. But we only have a couple of minutes here left. Do you have any additional comments you want to make? Any closing golden nuggets you want to share before we sign off here?
So to everybody that's watching today, thank you for joining us. I appreciate you taking the time out of your schedule to come in and join, listen, and hear what I got to say. I would say put yourself in the shoes of your consumer, put yourself in the shoes of the customer and say, would I like to do business with me? And when you're going through that, find ways in which you're the easiest business to do business with. Find ways that you're the easiest place to support, the easiest place to give my money to. And if you can do that, you will be in a better place going forward. So just put yourself in the place of the consumer and find ways in which you're easier to do business with. And the Weave platform is one place that I've used. I use the whole ecosystem in my office, and it has been definitely a game changer for my office.
Love that. Thank you. Appreciate that. Looks like we got one question that came in. It sounds like your advice is very, they love it. They want to know if you have any advice on collecting delinquent accounts. Do you have experience in there that you can share? So
at my office, I require 100% payment for any goods or services before I process an order, which helps my accounts receivable become much better. But we give them a million different ways to be compliant up front. Now, a delinquent account like a balance that was later on due to insurance, that's different. And we just send them in multiple ways. But after a while, they don't want to actually pay the balance. Is really difficult. But I think just making it as easy as possible to pay the balance. So if they don't have to call you, if they don't have to get on the phone with you, if you can text and email them a way to pay it to make it a little easier, or you give them a split payment solution if it's a high balance, I think makes it a little easier so that people can continue to do business with you.
Great. Excellent. Great answer. One more question that came in. It was more of a product related question for us about what kind of practice management systems we integrate. So we will reach out to you directly, Melissa, on response to that. Appreciate the question. Doesn't look like we have any more questions. So I think we're good here. Dr. Ramsey, again, appreciate your time. That was amazing. Look forward to further engagements with you and appreciate your time. Congratulations on your success too, by the way, and thanks for all you do.
Thanks for having me. I appreciate it. See you soon.
Awesome. Great. Thanks, everybody.